Hello and welcome to our presentation on understanding the difference between face coverings, surgical masks, and respirators during the COVID-19 crisis. This is a 13-minute presentation. Okay, so let's start with the first category, which is cloth face coverings. And the first comment is these may be commercially produced or improvised. Could be homemade garments, scarves, bandanas, or even items made from t-shirts and other fabrics. They're worn in public over the nose and the mouth, and that's really an important comment because sometimes, I've been out in public where, I've seen people who wear these face coverings and they pull them down just so their nose is not covered, and whether it makes it easier for them to breathe or their glasses are fogging up, but really they're not effective at that point because really the whole intention of these is to contain the wearer's potentially infectious respiratory droplets produced when an infected person coughs, sneezes, or talks. And that's what's really important here is because you're trying to prevent those respiratory droplets from getting out into the air and potentially affecting others if for some reason the person is asymptomatic and don't realize they may have the virus. These are not considered personal protective equipment or what we call PPE. As I mentioned, they will not protect the wearer against airborne transmissible infectious agents due to the loose fit and lack of seal or inadequate filtration. Okay, a few more comments about cloth face coverings. They are not appropriate substitutes for PPE, such as respirators, like an N95, or medical face masks, like a surgical mask, in the workplace where respirators or face masks are recommended or required to protect the worker. A good example of that might be a healthcare setting where maybe they require a surgical mask. Well, certainly due to that scenario, you would not use a cloth face covering. They may be used by almost any worker, although those who have trouble breathing or otherwise unable to put on or remove a mask without assistance should not wear one. They may be considered disposable or reusable after proper washing. And I think it's important to understand if you purchase one that is reusable, look at, they may have a limitation of how many times it can be washed, and they may have very specific washing instructions. So I think it's important to keep that in mind. Okay, on to the next category, surgical masks. And these are typically cleared by the U.S. Food and Drug Administration, which is the FDA, as medical devices. And although you got to remember that not all devices that look like surgical masks are actually medical grade or cleared devices. So keep in mind, this is a photo of one that is a surgical mask, and others may look like this, but if they're not FDA cleared, they would not fit this category. They are used to protect workers against splashes and sprays, droplets containing potentially infectious materials. They may also be worn to contain the wearer's respiratory droplets. So I think that's important. And so I think of healthcare workers such as surgeons, they wear them to avoid contaminated surgical sites, and dentists and even dental hygienists wear them to protect their patients. They should be placed on sick individuals to prevent the transmission of respiratory infection that is spread by large droplets. So again, somebody that maybe is known to have the virus, these surgical masks are used so while they're coughing, talking, or sneezing, it is protecting others in the room. And a few more comments on surgical masks. They will not protect the wearer against airborne transmissible infectious agents due to the loose fit and lack of seal or inadequate filtration. And again, just like a cloth, a cloth face covering, they can leak around the edges, top, bottom, and both sides. They may be used by almost anyone and should be properly disposed of after use. Okay, so on to the third and last category, which we call respirators or filtering face pieces. These are used to prevent workers from inhaling small particles, including airborne, transmissible, or aerosolized infectious agents. They must be provided and used in accordance with OSHA's respiratory protection standard, which is 1910.134. That's just the respiratory protection standard that OSHA follows and requires employers to follow. They must be certified by NIOSH, which is the National Institute of Occupational Safety and Health. However, OSHA has temporarily exercised its enforcement discretion concerning supply shortages of these disposable FFRs, or what they call filtering facepiece respirators, including as it relates to the extended use or reuse. So there's a separate document that talks about extended use of these products and how you can reuse them, use beyond their manufacturer's recommended shelf life, so another separate document that talks about that. And again, when I give you the link at the end of this presentation, you would be able to click on those links and read more about that. And then the use of equipment from certain other countries and jurisdictions. That's important because in lieu of the fact that we have limited supplies of these NIOSH approved N95s and there are shortages, we have an ample supply of respirators that are coming, for example, from China that are called KN95s, and we'll talk about that on the next slide. And then last but not least, decontamination, and there's another document by OSHA that talks about that as well. So a few more comments about the respirator section that OSHA talks about in these frequently asked questions. They need proper filter material. So an example would be an N95 or better, or other than for loose fitting powered air purifying respirators. They need a tight fit to prevent air leaks. And what they mean by loose fitting is that these powered air purifying respirators sometimes have a loose hood that would go over your head, but you're getting fresh air filtered through a battery operated filter that's blowing air into that hood and keeping the contaminated air from getting in. These respirators require proper training. They require fit testing, primarily if you are over the permissible exposure limit in an industrial setting. If you are wearing these products, N95s and these substitutes, KN95s, voluntarily or for nuisance level dust or just for general protection from the coronavirus, fit testing would not be required in those situations, but so it has a lot to do as an employer if you're mandating whether these be worn, whether fit testing is required. But again, you should still do proper training. And again, if you are doing fit testing, you got to deal with medical evaluation and monitoring, cleaning, oversight by a knowledgeable staff member. So OSHA has temporarily exercised its enforcement discretion concerning annual fit tests. So people that had been previously coming due for an annual fit test, there's some discussion about temporarily extending that, but if you do have fit testing supplies, you should still try with good faith to do that and follow those requirements. So getting back to this KN95, and the photo shown here is an example, and again, most KN95s on the market are an ear loop variety, but you know, in lieu of the fact that if you cannot find NIOSH approved N95 respirators that you needed for your workplace to protect your workers, and you've exercised all other NIOSH approved options, and you've searched and talked to us at Conney Safety to try to find substitutes and are unable to find it, again, OSHA is allowing you to explore the option of these KN95 masks, because they, in the viewpoint of NIOSH, they feel that those that meet those requirements from those countries do fit the bill for at least providing a similar level of protection, of a protection factor of 10, and I think that's what we're looking for. So in the times when we are struggling to find supply of N95s that we had currently been using in our factories and on construction sites. The KN95 might be a good substitute for you and in your scenario. So I think it's important to talk to us, talk to our safety support team here at Conney Safety if you need to, and we can help determine if this is a viable option for your scenario. And a couple more comments that OSHA had noted in their frequently asked questions on this last category of respirators is that when necessary to protect workers, require a respiratory protection program that is compliant with OSHA's 1910-134, and filtering face piece respirators may be used voluntarily if permitted by the employer. I mentioned that on the previous slide. And if an employer permits voluntary use, employees should receive information contained in Appendix D that talk about the voluntary use of those respirators, just to make sure that they understand they still need to take care of that respirator and understand how to put it on properly. Okay, and in conclusion, the references, here is that link that, again, I had pulled this information from. It's a frequently asked question portion of the OSHA website, and an easier approach is to do a Google search under frequently asked questions, OSHA COVID-19. It's basically a frequently asked question on cloth face coverings. It was published June 10th of 2020, and I do want to just finish this off by saying, there were a few other questions that OSHA poses as frequently asked questions, and one of them was if workers should wear a cloth face covering while at work in accordance with the CDC's recommendation for all people to do so when in public. And so OSHA generally recommends that employers encourage workers to wear face coverings at work. So face coverings are intended to prevent wearers who have the coronavirus disease 2019, or what we call COVID-19, without knowing it. Okay, so those people that are either potentially asymptomatic or pre-symptomatic, to keep them from spreading potentially infectious respiratory droplets to others. This is known as source control. So it's really important, and I think we're seeing a lot of companies, and Conney Safety included, that it's a requirement to wear to wear face coverings while in the building. We wear it in the office, and so really that those respiratory droplets from coughing, sneezing, and talking. When we talk, it's not uncommon for people to lightly spit, and it's terrible to say it that way, but we have little respiratory droplets coming out of our mouth as we're talking, and having that face covering really helps to protect others around us. We still want to be aware of social distancing concerns and other issues related to keeping others safe, but this is a good start with that. So hopefully you got a lot out of this presentation, and if you have any questions, feel free to contact us here at Conney Safety Products. The safety support team can be reached at safetysupport@conney.com, and we thank you for listening today.